Hello and welcome to another episode of the Time with the Specialist Dental Edition on HealthAfrik. My name is Isabella Tete Ahinakwa. Time with the Specialist is a new segment on HealthAfrik that is dedicated to engaging with healthcare professionals in the specialized areas. And we are starting with the dental edition. On our first episode, we discussed oral hygiene habits, and this is a continuation of that discussion. Today's episode is in two folds. We'll be looking at some of the oral hygiene devices and then demonstrations on how to appropriately use them. We'll go for a quick break. When we come back, I'll introduce our guest to you and then start with the discussion. Stay tuned. You're welcome back from the break. This is Time with the Specialist Dental Edition on HealthAfrik. If you just tune in today, we'll be discussing about some of the oral hygiene devices and also demonstrations on how to appropriately use them. And we'll be doing this with our very own guest, Dr. Nana Akonorbea Addo-Kwafo from Dr. Martin Kerry Dentistry. In our first episode, I introduced her as our resident guest, meaning she'll be taking us through all the health-related issues on dentistry. Hello, Doc.
Hello.
Great to see you once again.
Great to see you
and
too.
You're welcome to this episode.
Thank you.
Right. Today's episode will be talking about some oral hygiene devices, and also you will demonstrate to us how to appropriately use them. I'd like us to go back to the olden days when people used to use chewing stick and this sponge. Then that is what we knew as brushing our teeth. What are some of the medical aspects or some positive medical aspects from that?
Okay, so with chewing sticks, mechanically it helps you to remove plaque from around your teeth. Also, there are some species of chewing stick that are believed to have antimicrobial properties, and they sort of halt the growth of microbes in the mouth. But notwithstanding that, there's been developments with these new oral hygiene devices we have because research has found that, with the chewing stick, with the way the bristles are, it's in the long axis as the handle of the chewing stick. So it's quite difficult to use it to clean the inner areas of the teeth. That's the teeth in contact with your tongue and the parts of the teeth in contact with your palate as well. And also we realize that with the chewing stick, with how it's used, constantly with use, you realize that you focus on the anterior teeth and you tend to neglect the posterior teeth. That predisposes those ones to caries as well. And also with the constant brushing action, there's a tendency for your gum to recede. Because of the action. And also you're not able to use the chewing stick to clean the tongue appropriately as the newer devices we have.
So as our scientists were doing researches, they got to know that, we need to transition from the old method of brushing our teeth to what we see now, which are some of the toothbrushes and also auxiliary aids. Can you give us some of the importance of these devices?
Okay, so basically, day in and day out, as we eat, we get food particles being trapped in between our teeth. We also get food debris on our tongue. And as these debris stay there, they can cause mouth odor and all of that. So these devices are supposed to help us clean and get rid of these debris, get rid of the bacteria as well. So they help freshen the breath and they help get rid of plaque.
I know someone who never used a toothbrush. According to the person, he was born into a family that used chewing stick. Do you understand? Like, they still go with the olden days of. There are a lot of misconceptions. So what are some, as being a dentist, what are some that you've encountered in terms of toothbrush or in terms of oral hygiene devices that you've encountered, and how do we, or what are the truth and facts about them?
Okay, so one very common myth is people think that it's better to use a hard bristle toothbrush because that would do the work very well. But that's false. So we actually prefer that you use a soft bristle toothbrush because with a hard bristle toothbrush, the bristles are stiff and so they don't move around easily. But with a soft bristle toothbrush, it can actually reach certain areas of the teeth, including in between the teeth.
Okay.
Yeah, and also with a hard bristle toothbrush, with time, it wears away the enamel close to the gum. Then also it causes your gums to recede.
Okay.
Yeah. There's also another myth that flossing is not good because it creates spaces in between your teeth. That's actually false. The floss doesn't have the strength to wear off your teeth.
Okay.
Yeah, so it actually clears away the plaque that are filled the natural spaces that you're supposed to have in between your teeth. Yeah, and some people to believe that once you have a busy day, you can just pour some mouthwash into your mouth and you are good to go. But that's also wrong. The mouthwash doesn't have the ability to mechanically take away any plug on the teeth. And so you may use it and still have plug on the teeth. That would go to cause other problems for you.
There's another method of brushing which was done during the old days. That is hitting the plantain, the back of a plantain, then mixing it with charcoal, and then and that is all for the day. What's your take on that process?
Well, that process too is not effective enough because with that you are concentrating more on the anterior teeth. Then you forget about the other sides of the teeth. So with a demonstration, I'll show you that the teeth has like 5 sides which you are supposed to clean. And if you are not doing that, you can get cavities in any of those areas.
Now let's dive into the devices, especially with the toothbrush. I know there are lots of them. So if you can mention some of them and also the differences and its benefits.
Okay, so I'll start with the very common one that we are used to. That's the manual toothbrush. Yeah, so the manual toothbrush is what most of us use. We commonly use, yeah. And we have the electric toothbrush. So the electric toothbrush is similar to the manual toothbrush, but it's just that it operates with a motor that you can charge it, then you operate it with a motor. So with that one, the motor does more of the work for you. You don't have to use it manually like the manual toothbrush. Then with the manual toothbrush, we also have the interdental toothbrush. So the interdental toothbrush, that one is quite smaller. The bristles are like spikes. Yeah, so it's able to go in between your teeth to clean it. And that one is usually recommended for people who have white spaces in between their teeth and they get food trapped in there. You can put it in, then clean to be able to get the plug on that side of the teeth off. Yeah, also we have the sulca toothbrush. So the sulca toothbrush is a single tuft toothbrush. Yeah, and it has a pointed tip. So it's able to go around the gums to get rid of plug in that area. Yeah, and usually it's recommended for, as I said earlier, people who have spaces in between their teeth and also people who have bridges and crowns in their mouth can use it, as well as implants to clean around the crowns, bridges and implants effectively. Yes, and also we have the chewable toothbrush. I know it's not quite common in our part of the world, yeah, but the chewable toothbrush, it's a small gum that you put in your mouth like a chewing gum. Then it has bristles coming out of it. Usually they are flavored as well, so you don't have to add toothpaste to it. So as you chew and swish it around, it cleans around the mouth.
And that is also effective?
Yeah, it's effective, but not as effective as the normal brush that we know. But for that one, you can, people who are sort of like manually handicapped in terms of like they have some sort of manual dexterity, they can use that, especially in their absence of their caregivers. They can chew that to have some sort of like fresh breath before their caregivers can come in to do the brushing for them.
All right, in my research I saw a word, it says auxiliary aids. What is that, and also what are some examples of that device or whatever it is, and how beneficial is that?
Okay, so basically auxiliary aids, they help with cleaning your teeth, but they cannot replace the normal toothbrush. So with the auxiliary aids, in as much as you brush, they also help you reach certain areas of the mouth that the toothbrush cannot do. Yeah, so an example is the floss. So with the floss, you can use that to clean in between the teeth. Yes, and with the floss, we have different types of floss. So we have some that are waxed and some that are unwaxed.
Okay.
So with that, it means that the thread has wax on it. And so when you use it in between the teeth, it's able to catch on debris. And so it cleans more effectively than the unwaxed. Yeah, and also with the waxed one, it doesn't tear easily when you are using it. Yeah, but the disadvantage with that one is if your teeth are very close together, it may be difficult getting it in there.
And you may even get hurt.
Yeah, and also with the floss, we have the floss picks as well. So that one, it comes with a handle, then you use that. That one is much easier to use, and that's what most people use commonly. Yeah, and also we have the pressure flosses. So that one you use it's sort of electronic, so it uses air pressure to try and get debris from in between your teeth out. Yeah, we have the water flossers too. They use water pressure to get the debris from in between your teeth. We have the tongue scrapers. They come in different forms. They come in wooden, plastic, metallic. So you use that to clean the tongue, to make sure that you are taking off food debris and bacteria from the tongue.
Okay, so as there is a toothbrush or a device for the tooth, there's also devices for the tongue.
Yes.
Interesting. I see there are lots of devices to clean our teeth and also our mouth. Is there a situation where maybe a device would be preferable than the other?
Okay, so well, that would depend on the condition that the person is in, as I said earlier. So in trying to maybe get a toothbrush, you may want to look at the condition, the reason why you need that oral hygiene device. So for example, with a sulca brush, someone who has a bridge or a crown or an implant in the mouth will want to get that to be able to clean around that area very well. But someone without those
medical issues,
yes, would not want to get a sulca brush. And also depending on your manual dexterity, you may want to go for an electric toothbrush or a manual toothbrush. Yes.
Okay. Now, let's say I want to get a toothbrush or I want to get one of these devices. I walk to the market, see anything and just buy it. I don't think that is the right thing. I'm sure there are some factors you need to consider when going in for these devices. Being a dentist, what do you think are some of the factors we should consider when purchasing all these devices?
Okay, so you would want to consider the size of the head of the toothbrush. Yeah, so you would want to go in for a size that you can easily move around in your mouth. If you go for a big size, then that means that when you put it in your mouth gets full, then it's difficult to move it around. So at the end of the day, it's not able to do the work effectively. Yeah, so ideally, we are advised to go for either a 1/2 inch wide or 1 inch tall toothbrush so that you can easily move it around to the back areas as well. Yeah, and also you want to look at the stiffness of the bristles. So on the market, we have the soft bristle, the medium, and the hard bristled. Yeah, it's advised to go for the soft bristle so that you can clean properly with it. And when it comes to the shape of the head of the toothbrush, it doesn't really make much of a difference. But with it, we have square shaped, we have oval shaped, we have diamond shape. But it's believed that the diamond shape is able to clean the posterior areas easy because it's able to get there easier than the square shaped and the oval shaped.
So how about the materials used to create or manufacture these devices? Because I used to produce an acrylic show and then we went to a pig farmer who made mention that the skin of the pigs are used to manufacture these, especially toothbrush and other brushes. Should we also consider the material used and also the plastic used in these devices?
Okay, so with the materials, it may be difficult to identify that because most manufacturers may not write it on it. Yeah, but if you use it, and let's say you use it, the handle gets broken, then you know that it's not of good quality, so you'd want to try another brand.
All right. Before we end this session and then go into the demonstration, I would like to know, obviously you can't use a brush for a year, you can't use a brush for 2 years, which I know most of us fall victim or do that. I'm sure a secondary school student will never change his or her brush until he finishes school. How often do we have to change these devices and then use another one?
Okay, so ideally, we are supposed to change our toothbrushes every 3 months.
3 months.
But for you may have to change it earlier than that, especially for those who brush aggressively.
Okay.
Yeah, but in as much as the thumb of rule is 3 months, if you notice that the bristles are freed, then it's time to change it because it won't be able to work effectively.
And that is all for the first segment where we discuss some of the oral hygiene devices. We'll be moving on to the second segment, demonstration on how to appropriately use them. Please stay tuned. We'll be right back.
Okay, so we are about to have a look at some of the oral hygiene devices we talked about, look at some features as well as demonstrate how they are used. So this is a manual toothbrush. This is an electric toothbrush. This is a tongue scraper. And these two are floss. Okay, so the manual toothbrush. The manual toothbrush has a handle, it has a head, and it has a bristles. So as we said earlier, the head could be square shaped, it could be oval shaped, or it could be diamond shaped. And the bristles could be hard bristled, medium bristled, or soft bristled. This is the electric toothbrush. So the electric toothbrush, we have two types. We have the rotary type and the sonic type. So the rotary type works by rotating, then the sonic type works by vibrating. So both are effective in taking out plaque from the mouth, but the sonic type has an edge over the electric type because it vibrates at a very high speed, and so it makes it more effective. So this is the motor and this is the head. You can take it off after brushing, then keep this in a safe place, and when you're ready to brush, you can put it on. So this is the vibratory type. So as you power it, it vibrates. Okay, and this is a tongue scraper. So this is the plastic type, or we have the wooden type, we have the metallic type as well. You realize that this side is rough, so it's able to scrape the tongue and take out bacteria and food debris. Then both of these are floss. So this is the pick floss, which has the handle that you can use. And this type of floss comes as a thread, which you pull out and you cut part of it, then you use it. So I would like to demonstrate how to brush effectively. So before I delve into the demonstration, I would like to talk about the surfaces of the teeth. We have 5 surfaces of the teeth, and the aim of toothbrushing is to make sure that you are cleaning all these surfaces. So we have the outer surface of the teeth. We have the inner surface of the teeth. We have the chewing surface of the teeth. Then we have the interproximal, which is in between teeth, and that's 2 surfaces, which is the right and the left on each side of the teeth. Yes. So with toothbrushing, you would want to do things in a systematic fashion such that you don't leave out any part. So you can divide the tooth into 4, which is the upper right, the upper left, the lower right, and the lower left. So with the outer portion and with the inner portion, you angle the toothbrush, the bristles of the toothbrush at 45 degrees, such that the bristles are able to penetrate in between the teeth and a little bit underneath the gum. Yeah, so you position it at 45 degrees, then you brush gently with a circular motion. So you do that starting from either the right or the left through to the other side. Then with the inner surface, you do the same thing, both upper and lower. But when it gets to the anterior teeth, you'll be able to clean better if you position the toothbrush vertically. Then with a back and forth motion, you can clean it easily. Then when it comes to the chewing surface of the tooth, you use a back and forth motion to clean it. After brushing, you should not forget the tongue, a very important part that most people forget. So with the tongue, you start from the back of the tongue to the front in a swiping motion. So you do that about 3 or 4 times to make sure that you are cleaning effectively. With the tongue as well, you can use the tongue scraper. So with a roughened edge, you use that back and forth from the back to the front about 3 or 4 times. I mean, in a back and forth motion, yes. Then I would go ahead to demonstrate how to use the floss. So with the floss, this is the pick floss. It has a handle, and that is what most people use. It's quite easier to use. So with that one, you hold the handle, then you move it to and fro, get it in between the teeth and out to get out any food particles, any plug or any debris there. I would also like to demonstrate how to use the threaded floss. So with the thread floss, you take about 18 inches of the floss. Then you wrap it around your index finger. Then you support it with your thumb. Then you move in and out. But you angle it in a C shape towards the tooth so that you can effectively clean one side of the tooth. Then you angle it at a C shape to the other tooth. Then you do the same thing. So you do that for all of that. It is advised that if you would floss or use the tongue scraper, you do that before brushing generally so that you can get rid of any debris that fall out from these areas. It's usually advised that after brushing, you spit out the toothpaste. Then you leave the remnants of the toothpaste in your mouth so that the fluoride can diffuse into your teeth. But if you would want to rinse, just use a little amount of water and do not rinse vigorously.
Thank you very much, Dr. Addo-Kwafo. That was really, really educative.
You're welcome.
Really learned a lot. And that is all for this episode. The question is, which oral device are you using? And are you using them appropriately? And did you also know that there were other devices you could also use? Well, that is all we brought to you on this episode. My name is Isabella Teta Hinakwa. If you just tuned in, this was Time with a Specialist Dental Edition on HealthAfrik, and you can watch or follow the discussion on our social media handle at Association of African Universities on both YouTube and Facebook. Today was with Dr. Nana Akonorbea Addo-Kwafo from Dr. Martin Carey Dentistry. She'll be with us all through this edition. So stay tuned for more informative and educative episode on HealthAfrik.